I often get asked this question. So how do you deliver physical therapy virtually through telehealth? I completely understand that a lot of people cannot grasp that concept, but I am here to tell you that it not only works, it is a great way to bond. It's a great way to teach patients how to use their environment in their homes to get what they need in order to recover their function and get back to a normal way of life. So virtually, I have the opportunity to work not only with parents who are my hands to deliver care to their children, but also adults. Some of them have been recovering from COVID-19. I have patients who's been on dialysis as a result of COVID-19 and now have permanent kidney failure. We are dealing with hip fractures, foot fractures, post-operative internal fixations due to falls and broken hips, you name it. We've seen it through this virtual model and it has worked. So I combined a variety of things. My knowledge, number one, and skills and expertise of over 20 years as a physical therapist. I use a gamut of things, including resistive bands that are mailed to patients at the level that they currently are when we start and advance them through the course of action. I use props, aids, I demonstrate, I go through exercises with the patients, I correct, I guide, and I coach along the way. So if you ever doubted it, please forget that. There's no reason whatsoever to think that physical therapy is not a possibility for you and delivering you care through a virtual model. I must say that there are some patients that come our way that they don't work. And those usually are people who have very, very involved cases who do not have caregivers at home. For instance, I had a patient who had a spinal cord injury. He was pretty much total care, so his wife would put him in his chair during the day and she went to work. So during the day he was at home by himself without any assistance. So in this case, for obvious reasons, he needed someone in his home. So when we come across cases that are outside of the scope for virtual services, we do assist by transferring that case to someone who can come into the homes. However, we can deliver safe, effective care through a virtual model. We will assess and determine the appropriate course of action for each case. If you have any questions, please ask. Ten, 11, 12, 13, 14, and 15. Good. Switch sides.